The New Mexico Center on Law and Poverty is dedicated to advancing economic and social justice through education, advocacy, and litigation with an emphasis on impacting the most vulnerable New Mexicans. We have a specific focus on access to health care for low-income folks here in our state.
We work primarily on behalf of hardworking New Mexicans, people who are often paid low wages or underemployed, families with children, people with disabilities, and people who are unable to work.
You know, when we talk about low-income New Mexicans, we're really talking about folks who are making around 200% of the federal poverty level. This includes the elderly, children, families, low-income adults. Really, it's a broad range because our work relates to Medicaid, which is now covering over 900,000 New Mexicans.
The main barrier that we're trying to address is access to health care. We want everybody to be able to have coverage so that they can go to a doctor when they need to go to a doctor, so that when they go to a doctor, you don't end up with a $100,000 bill that you can't possibly ever pay. There's a history of disenfranchisement that have racial and class dimensions, which means that especially immigrant communities, Native Americans, people of color, and people living in very low-income communities are the ones who get left out of the system. A lot of the center's healthcare work is centered around Medicaid because it's so important to our families, and unfortunately, it's constantly under different threats. Right now, we're facing devastating budget cuts, both from the state level and also from the federal level.
We do everything from community education, working with community members and organizations to make sure that they know their rights, how to access healthcare. Sometimes we'll work with them directly if they have issues in terms of application barriers or actually getting services and benefits. And then, if necessary, we'll do litigation.
The litigation that we're doing around Medicaid, we have a lawsuit that's been going on for 20 years with the Human Services Department that runs the Medicaid program. And out of that lawsuit, the court ordered that the Human Services Department must fix certain application barriers in the Medicaid program and in the SNAP program.
Living in the rural and frontier areas means that access to care is crucial. New Mexico has one of the highest workforce shortages around healthcare providers in the country, and a lot of that is in our rural and tribal areas. We're a pretty unique organization in New Mexico. I don't know that there's any other organization out there that does what we do in terms of being able to provide the legal expertise as attorneys, but then also the policy advocacy at the legislature, and then being able to distill all of that information for the community into information that they can use to have their voices heard.
I ended up with cancer, breast cancer, and I was going through treatments, and about 6 months down the line, I found out I didn't have insurance. So we had to stop all treatment. It was like a nightmare. I didn't know what to do. I couldn't sleep, I couldn't eat. Every time the phone would ring, it was just horrible. It was just a great nightmare. I didn't know where to turn to. I don't know where they would go if it wouldn't be for this program, because it's just a complete dead end for some people that have no place else to go. And I am so grateful for this organization that helped me. I don't have enough words to thank them. I don't even know how to thank them because a thank you doesn't seem like it's enough.
With CONALMA's support, the Center on Law and Poverty has been able to achieve some really significant victories for our families.
CONALMA is a well-respected organization in New Mexico. Being able to provide the grants that they do to multiple organizations that have an impact on healthcare access. The Voices for Children, the Health Action New Mexico's, the New Mexico Center on Law and Poverty's, those type of organizations in our state to be able to do that high impact work that increases healthcare for everyone is such an incredible asset to have. And so having an organization like CONALMA to help be able to fund that work is just something special.